Good morning, hoş geldiniz, and günaydın, marhaba. Very, very warm welcome and top of the morning to all of you. Thank you for coming to the morning session. As you know, the topic of our session today is digital health transformation, and we are going to be having one speaker talk about transformation and healthcare workforce development on digital health in Dubai. And then we also have the pleasure of, or we had the pleasure, I think His Excellency the Minister of Namibia, Dr. Kambuli Shangola, just walked out, but he will be back. So I'm sure those of you who are present have some sort of interest in digital health. To set the stage for digital health, and first of all, my name is Dr. Irshad Sheikh, and I'm the head of WHO's European Regional Center on Emergency Preparedness in Istanbul. We had just established this last year, and COVID-19 had only underscored the importance of emergency preparedness, as Dr. Tedros rightly had said, and eloquently, that no country was prepared per se to address the pandemic at the scale, scope, ferocity, and the speed at which the pandemic spread. But again, digital health has tremendous implications on emergency preparedness also. And COVID again underscored how digital health and traditional health can come together and improve efficiency, effectiveness, timeliness of response, and now also ongoing efforts on recovery. To set the stage, digital healthcare ecosystem is an infrastructure that supports the transformation of organization-centered model to patient-centered model. Conventionally, we used to have patients come to a facility and organization and try to negotiate various service provision focal points or latching points. What digital health has done is transformed organization-centered model to a patient-centered model, improving efficiency, effectiveness, and again, not just treatment, but also wellness and prevention. So all things at one-stop shop is simply the digital health transformation. And in COVID-19, we can say was a blessing in disguise also for digital health. Telemedicine. The issue always in countries, in middle-income countries, low upper-income countries, upper middle-income countries like Turkey, we were always worried about coverage of primary health care. And telemedicine catapulted the increase in coverage, accessibility to a certain extent, and also cost-effectiveness of providing services. Of course, there are privacy issues. Coming from United States in the domestic health system and with the US CDC for over 15 years, privacy in US is a most critical element of digital health transformation. And we have very stringent regulations, what we call HIPAA, Health Information Portability and Privacy Act, which imposes tremendous challenges, but at the same time has really put guardrails around how patients' record can be prevented from hacking and also from what should I say, unjudicious use of patient information. Bottom line, that in COVID we had telemedicine, artificial intelligence, big data, Internet of Things. These are sort of the digital health elements that were used to improve contact tracing, modeling of disease of COVID, improving screening and management of patients, and also making sure that the judicious use of overworked healthcare workforce. So digital health is the way for the future. There are no two ways about it. And every country, to a certain extent, is trying to adopt digital health technologies to improve service delivery. And the electronic health records, I think, is the most common, lowest common denominator that every country is trying to adopt, moving towards digital health transformation. So, of course, I'm not the speaker, so I was just trying to set the stage. But having said that, we have Dr. Osama from Dubai Health Authority. but who is presenting today on part of Zimama, an NGO in Dubai, and he's going to be talking about healthcare workforce development from digital health perspectives. So please welcome Dr. Osama. Thank you.
Can I get my... hello everyone. So my name is Osama Hassan. I'm coming from Dubai. I'm actually a specialist at a department called Health Informatics and Smart Health, which is part of the health regulatory sector in Dubai. However, today I will not speak much about DHA. However, DHA and Dubai have done a lot with regard to digital health. And just last year, we rolled out our first health information exchange project in Dubai called NABID. And actually, this is one of 3 HIEs that we have in the UAE. So we have Malaffi in Abu Dhabi, NABID in Dubai, and Riayati with Ministry of Health. And we have a plan to connect them all together in a HIE of HIEs. So we can generate population health reporting across the country. If talking about DHA itself, is a regulator and also healthcare provider. We have 5 hospitals, 23 primary care centers. We run one of the best EMRs, which is EPIC. We've done this in 2017. We rolled it out. It was a really difficult journey for us. However, we learned a lot. And specifically me, I learned a lot, especially about the importance of workforce. So what we know, especially in digital health, digital tools, digital softwares are enablers. They can allow good things to happen. However, only people who can make things happen. And we, unfortunately, most of the time, leaders do not see. Okay. So unfortunately, even at the leadership level, they don't see the importance of workforce within the digital health transformation. They take it for granted. And because of that, a lot of projects failed, or at least they didn't reach their final goals. So because of that, even this specific EPIC project was a personal inspiration for me to understand the big gap that we have at the leadership on the understanding of the importance of workforce. And I started to talk to scientists, government leaders who share the same vision for me, that there is a big gap that we need to bridge at the leadership level, at the academic level, making sure that all our universities and academic institutes are actually providing us with the right supply of talents who can help us with the digital transformation. So we started this. Actually, it's not working. I think it's not working.
You rely on digital health, that's what happens.
Okay. It was working before.
Yeah, it does.
Yeah. You can say next. I will say next, and you just move. So today's agenda, we'll talk about ZIMAM. What is ZIMAM? ZIMAM is the initiative that we created to fill in this job. So we started this journey in 2016. So So this is the agenda for today. We'll talk about ZIMAM. We'll talk about what's the science behind ZIMAM. We'll talk about what's the methodology, what we've already reached, and then we'll have some Q&A. So what is ZIMAM? So in 2016, as per my experience, personal experience, I tried to So it was very easy. So normally we had an Nhs event every year in Dubai. So I tried to sneak all those like-minded people. Guys, let us meet separately for an hour to discuss an idea. And I managed to get, like, in the first time, 6, 7 people. The second time, maybe 10 people. Guys, do you agree with me that this is really a big gap that we need to bridge? And they all liked the idea, and we decided together to form ZIMAM, which is a purely scientific, non-for-profit initiative to support the awareness and the development of our workforce. We put some sort of high-level goals that we need to achieve. It was very simple.
Sir, I'm sorry.
Okay.
Skip this.
Okay. So this is the first group of people who came together to form ZIMAM. We were covering several GCC countries, Saudi, Kuwait, UAE, Qatar as well. So, and this is the second wave of experts who joined us in the last 2 or 3 years. So what was the inspiration? So the inspiration for our work was the steady growth of digital health adoption in our region. We see a lot of money is poured into EMRs, HIEs, public health. A lot of investments is already happening. We have a massive universal health coverage programs around health insurance. All GCC countries decided to refrain from, can you just, okay. All GCC countries decided to refrain from the welfare system where everybody goes to, to have free access to healthcare, to more cost-effective approach through insurance. And to develop insurance, you need to connect systems together. You need to connect information. So you need to pour more money on the connectivity and digital transformation. So witness shortage of local talents in health informatics, health information management, health information technology. We go to every hospital, we see 90% of our staff are expats. And even it was easy for us to acquire them and retain them maybe 10 years ago. But now, because of the shortage now is becoming a global problem, we see that we are losing them. So people want to leave even UAE to go to Canada, to Australia to get a better status, maybe a better quality of life. So now it's becoming challenging. It's not as easy as 10 years ago to just put an ad and you get like 200 or 300 people competing for this job. It's not happening anymore. So we need to invest on our people. Make sure that we have our supply. So similar global and regional initiatives are already happening in the, we saw like AHIMA, they developed the Global Health Workforce Council. We saw a huge project was called EU-US Health Work. It was about understanding what are the requirements, what are the competencies required to support digital transformation. So we decided that what is our vision is sustainable digital health ecosystem in which local e-health workforce is empowered and taking the lead. So this is the vision that we want. How to achieve that is to improve healthcare e-health skills and competencies of national human resources in the fields of health information management, health information technology, and health informatics. And the only way to do this is through continuous training and career development pathways. So without having, because we realize that even if you have a good graduate from the School of Health Informatics in a good university, when he joins one of our hospitals as a health informatician, after 2 or 3 years, we find them shifting to management or pure IT roles because they don't have a career path. They don't have a career progression. So they move to other directions. We need to stop that. So what's the tool for that? Is to measure, is to educate, and to empower. And this was the way. So what was the roadmap for ZIMAM is to get a recognition. So what we are doing, what's the importance of our role? To develop partnership with government, with similar organizations across the world, with health professional organizations. So we need to develop a network of partnerships to support our mission. we need to create some sort of a digital health job market assessment. So before saying that we need to do 1, 2, 3, we need to understand what is the status quo, what are the challenges, what are the issues that we need to tackle. We need to have a digital health competency-based framework. So if we want to connect or to bridge the gap between academia and the industry, the only way to do that is to develop a competency framework, saying that for a successful health informatician to work in the market, you need 1, 2, 3, 4, 5 skills to be strengthened. Otherwise, they will not survive. So competency-based framework is the best way to bridge between the two worlds. Finally, we don't need to do things on paper only. We need to have kind of a digital healthcare ecosystem where me as a new graduate who doesn't know what's happening in the other side of the fence, so I don't know what's happening in the market. I need to go to a tool or to a platform which tell me you need to strengthen this competency. You need to get this certificate. You need to be an HL7 fire expert so you can get better jobs. You need to improve your skills in programming in this language so you can get better jobs with these companies. So it's kind of a platform where you log in, you put, they give you assessment, and then you will see similar jobs that are matching with your features or your capabilities, and things will go up. So we think that this is the right way to do things. So through the 4 years or 5 years of work, we managed to develop some sort of output. So we managed to increase awareness through eHealth Workforce Conference. So we did four conferences starting from 2018. We now developing an empowerment platform, and we developed some sort of recognition to the good achievements in the GCC. Not please, okay. So we developed what we call the MAM Awards to highlight good work around health informatics, digital transformation. It was a very successful way to appreciate the good work. Not only good projects, but good projects that really utilize our resources. Not those projects who were relying on IBM or Accenture or external resources or external companies to do the work for us. Those were all were excluded from the. So the first criteria for selection is how do you manage your workforce during this project? So to achieve this, we developed some sort of partnerships. We'll talk about it. We developed a talent pool. We developed a survey to understand what's happening in the market. So this is the conferences that we have done since 2018, an annual conference focusing only on workforce development. We brought experts from all over the world, from Australia, from US, from UK, who have the same issues, and they developed some solution. For example, like Nhs Digital, they developed Nhs Digital Academy, because they realized that NHS long saga of failures in digital transformations in the 90s till the 2000s were because of the lack of the right talents within the system. And because of that, they developed the Digital Health Nhs Digital Academy, and from there, they started to see success stories. So last one was actually last week in Dubai, and was really, really successful. We had around 105 speakers coming from all over the world to discuss this problem. I don't know. Yes, okay. So we developed a survey in 2019 with the support of experts from US who've developed similar surveys to understand what's happening in the market. We came up with a lot of data. We got 600 responses across GCC countries, and we understood that there's a big gap in skills in health informatics. Even the payments for those experts are not enough. Most of them are moving from the sector to another sectors. Most of them, they feel they are more of controlled by pure IT rather than clinical informatics or health informatics. These are the challenges that we have in the market. We developed also the MAM Elsevier Awards for 2 rounds. we highlighted good projects like the best project of the year, the best digital transformation project of the year, the best COVID-19 project of the year, the best nursing informatics unit of the year. So we try to catch those areas that nobody knows about. We try to highlight them and appreciate their work. We got a lot of submissions that really showed good work that nobody appreciates. So this is also a good experience that I think that even in Turkey, you need to have something similar to that, to focus not only just on the projects, but on the workforce part of it. So what's the science behind Zima? So this is our language that we are using. We are focusing on career paths, career ladders, career lattice. We understand that even the movement of an employee across the system, it should not only go vertical. I not see how to be a health informatics and then a manager, then a senior manager, then a director. This is the normal. But in health informatics, because things are changing every day, new skills are coming, new requirements, we see people moving horizontally. So you start as a project manager, and then you be a product manager, and then you could be a fire-based specialist. So you keep navigating at the horizontal level, but nobody's capturing this kind of movements. So we need also to have also this horizontal movement. There's a lot of clinicians, pure clinicians, they want to go to digital. They want to go horizontally. So how we can support them? So this is also another area which is very, very new and very, very promising. Career development is the general thing. Competencies, so we need to focus. So I can explain my capabilities as a set of competencies. And those competencies can be developed, can be cross-skilled, upskilled, or reskilled based on my requirements or through the job requirements as well. So part of that, we already developed the first competency-based framework for health informatician. This was a collaboration with our folks in Saudi, especially Saudi Commission of Health Specialties. They developed a career ladder for health informatician of 3 grades. And for each grade, to promote from grade 1 to grade 2, you need to fulfill a set of academic, professional, and even proof of work. So these are the set of competencies which are not only technical, and this is also very important. You need communication skills, working with different groups, how to communicate with doctors, with clinicians, with public health. All of them, they have their own jargons, their own way of communication. We need to be capable on that as well. So this is the vision that we have for a hospital of tomorrow. And I believe that many hospitals in Turkey already achieved this, but this still for us is a goal. It's not about having an HIE or an IT guys or health guys. We need to have a set of roles who are collaborating in the hospital environment. So if you can see here, we need the hospital setup. We need to have CMIOs, CNIOs, CIOs working together. Everyone has his own role. We need to see advisory groups. So advisory group could be doctors, could be people coming from Amazon, people who understand customer experience. They are not healthcare guys, but they can add value through how to understand how to deal with your patients digitally. Sometimes these experiences are not among doctors or health IT who are working in hospital. You need to have visions coming from patient groups, from other companies, other experiences. You need to have HIE and health informatics, clinical informatics coordinator in every department. You need to have an ambassador of health informatics in every department, radiology, pharmacy, OT, whatever, all those should have at least one ambassador who understands the language, who can support you with projects. You need to have physician champions as well. So in every specialty, you need to have at least one doctor who can talk the language of informatics. You need to have EMR builders. These are, yes, technology people, but now they know about healthcare. They know about specific verticals in EMRs. You need to have HIM, and unfortunately, even in our region, These are one of the less focus groups. People who understand what's the meaning of data, the people who contact with patient, who release information to patient. Unfortunately, this is a profession by itself. It's not an IT profession. They are more of social, more of legal, more of understanding patients. Unfortunately, I've seen a lot of hospitals who have closed their HIM department, and they are suffering because of that. So again, at the digital regulatory setup, we need to have even HIE specialists, people who are working on health informatics, health information exchange, advisory groups, same like the before, HIM staff at the regulatory level, onboarding specialists. So to roll out big projects like HIE is not only technical. You need a lot of change management, integration specialists. These are very important. At the analytics and AI, this is becoming very new. We need to have insurance experts. We need to have public health experts. We need to have HIM and coordinators. So if you see, I'm talking about hundreds of job titles, not only tenths of jobs. And unfortunately, these titles are not there yet. We need to support them. So I don't want to take more of your time. Part of our mission also is to support planning for those jobs. We need to come up with formulas. Say, if you are a 500-bed hospital, you need at least 2 HIEs for every 100 bed, 1 HIM for every 50. We need to help you to develop those future plans. I think this is one of our biggest tasks. This is kind of set of new jobs that we are seeing in the market today. And unfortunately, we don't have enough supply of them. Like CDI specialists, interoperability specialists, especially in fire, new resources. Very seldom, very few. Public health informatics. Now we understand what's the meaning of public health because of COVID. Privacy officers, people who understand things around HIPAA, GDPR, in healthcare. These are very few. I know 3 or 4 people in the entire region. We need to train a lot of people. Patient digital UX experience. This kind of talent, I don't see it very well. How you make your patient portal usable to patient. How to even exceed the patient expectations. Not only meeting expectations, but even exceeding expectations. Onboarding officer, people who know change management in digital health. This is now becoming a niche experience. So, and many more of these. So our methodology is to come up with this platform. I don't want to, so these are the goals of our platform: to provide education, certification, proof of work. Every talent should be having all these in the, stated in the platform. We provide training that connect academia with the market through apprenticeship, shadowing, coaching, mentorship. These programs will really help those young talents to become in the level that they are to be ready for recruitment. Services we can provide: job description labs, career choice communication. Yes, I am a nurse who've worked with 2 EMRs and I supporting them in the implementation. I want to have a new career in digital health. Where should I go? So we need to have some sort of advisory or service for them. Job fairs, digital health, LinkedIn, why not? Entrepreneurship, so we are not talking about jobs, even supporting people to come up with their own SMEs companies. It's not only for jobs. Only could be, if I'm a fluent fire programmer, I can have my own company. Why should I wait for a job? Yeah. So this is the, let's go. So this is kind of a sketch of our platform. Who are the stakeholders? How we are going to connect them? So we are still in the building phase of it. We've done the first or 2 demos on it, and we started collecting some funds to support it. So this is we're talking about talents, employers, connecting them through opportunities. So that's it. I think this is a kind of the number of international organizations who would be very helpful in developing contents for training, certification, We have a plethora of them. All of them can be part of this work. So finally, that's me, and this is my email if you want to connect. Thank you very much for your time.
Oh, yeah, I don't have any slides. Thank you. Thank you, Dr. Osama. That was an excellent presentation. If you're looking for a roadmap, how to start from A to Z or start from scratch and how to move forward, I just want to highlight some points that you identified that we rely on technology, but we forget human factor because the application and practice of this technology is through human workforce. And 2 points I forgot to mention at the start. One, that the center that I run is funded by government of Turkey, and also, for many of you, you may know, Turkey was the country which floated the proposal for WHO's World Health Assembly last year to have 2021 as the year of the healthcare workforce, and it was unanimously adopted by the World Health Assembly. And digital health transformation and healthcare workforce, I think this year, 2 issues that we are attempting to raise awareness and importance and make the marriage of the 2 elements. And I think your other element or focus on improving universal health coverage, which is also, once again, very strong emphasis by WHO. Partnerships with public and private sector and academia, I think that is also one element that we in health tend to forget, but in Turkey, it's one of the countries with best practices in bringing partnerships together. And also, I really loved the idea of out-of-the-box thinking, bringing Amazon or wherever you find the expertise in that area, customer services, of course, Amazon may be one of the, well, somebody may challenge that assumption, but still, for majority of the world, our understanding that is one of the entities that can provide good examples of do's and don'ts in customer service. And I think last point I would emphasize that your model of calculating X factor in future jobs, that could be the, once you, many countries which are still on that pathway can use that to go at a granular level as to how much workforce needs to be required in many other professions. But before, we'll have 2 things. One, we'll need to give certificates, and His Excellency Dr. Shangula would be kindly giving the certificates, but he's very busy, and we hope that he will come back and help us with it. But the other point that, only 2 points, Dr. Osama, and I'm sure there are many other colleagues in the audience who will have better and more prudent questions than I can. But my only comment to you would be that Dubai is a market with great literacy per se, health literacy per se, and also relatively high levels of digital health literacy. But in countries, let's say in the European region, where we have the low upper income countries in Central Asia, Western Balkans, Southern Caucasus, and then of course we have European Union and others. But in countries where internet access is still limited, and second point being that where digital health literacy, even despite COVID and telemedicine, is still very limited, how do we focus on those 2 elements? Because you did provide a very good model of supply and demand. So we can create a very good supply through this, but how to create effective economic demand from health economy sort of terms to improve acceptance, coverage, utilization, and benefit and impact of digital health at grassroots level or at the patient level. Those patients who are coming to a tertiary care hospital maybe most likely will be helped by healthcare staff, but those who are using primary healthcare, secondary healthcare services, if you have so many comments on how to improve the digital health literacy and in countries where internet access is still relatively limited, any thinking that may have emerged based on your roadmap, or if there are pockets of such in Dubai. Thank you very much. So, Dr. Sama, would you like to answer that question for us?
Sorry, I wasn't, are there any questions for me?
No, what I said was that in Dubai is a very saturated market in terms of health literacy and internet access.
Yeah.
In countries where internet access is relatively limited and digital health literacy is not that high, how can we increase the demand for digital health in those environments?
Well, it's a technology question. So even with poor internet access or weak, still you can develop technologies that can deal with this kind of issues. Like I remember, like even in India, for example, they have a lot of solutions which are based on SMS rather than internet connections. So you can select different medias, different ways of communication, and even different contractual relationships. So I believe in some countries, for example, they will allow you to have free internet packages for healthcare, only for healthcare apps. So this could be another way. It will be a win-win situation for telcos who can put their ads on these apps, or so they can get more engagement, even more customers, because they give this service. So sometimes you can see this as an opportunity rather than a challenge. I mean, for example, in Dubai, we don't need to do that because even people can buy packages without issues and use it. Actually, it's vice versa. Actually, the telco is paying money for companies who provide content, because people, they have packages and they don't use them. I have like 20 gigabyte package per month. I don't use it entirely. So if someone comes to telco telling them, if you, this is my software, this is my app, who will take at least 2 or 3 GB of your customer, they will be happy. So we have different problems and different ways to solve them. Thank you. Any other questions?
Ses geliyor mu? Thank you very much. İlker Daş'tan, WHO, Tajikistan Country Office. It was very, very interesting presentation.
I can't hear you very well.
You cannot? Can you hear me better? Is it better?
Yeah, yeah.
Okay. So thank you very much again. I'm WHO Country Office in Tajikistan. My name is İlker. So one question, I mean, it's very similar to Dr. Irshad's question, but so it's interesting to see such a high-income country to move towards improving its health workforce for digitalization. But what would be those still also interesting that a country like one of the richest countries in the world is yet to move in this direction? But what would be the take-home messages for countries like Tajikistan, like a low-income country, low-middle-income country, from the overall perspective, not only from the health literacy or creating demand, but how can a country like Tajikistan, where the whole health system is still on paper-based, so digitalization is still a vision for the next 10 years, 20 years, 30 years. So what can we really learn from such an example? And the second question, if you allow me, is...
So here the message for whom? For the government or for the people?
Both.
So different message.
Of course, definitely. Definitely. The better is...
example for Turkey, for example.
Definitely. And my second question, if you allow me, please, is what you've been mentioning so far about the improving the health workforce for digitalization is from the hospital perspective. And also you mentioned a bit about the public health. But as you know, like the main the data comes from the primary healthcare, especially for countries like low and low middle income countries. So how to really improve the workforce competencies?
Within hospitals.
Not hospitals. I'm talking about primary healthcare. So like how you can really integrate such projects for the primary healthcare. Do you have any examples for that?
Okay, so for the first question, so I'm talking about Turkey. So what I understand that, for example, the academic system or the university systems in Turkey is very advanced. However, I think still that with regard to clinical informatics and health informatics, you still need to do more in terms of number of master programs. So I think this should be more, I was really surprised with, I saw this big exhibition. I haven't seen even a single university presenting, showing their programs. So that means there's still a gap. I believe that there's a gap between academia and the industry. Second, I haven't seen also the presence of the Society of Health Informatics in Turkey. I know that there is a health informatics society in Turkey, but it seems that they are not active in bridging this gap. Because it's not only government, private sector. You need to have your own voice as informaticians. I don't see this very strong here. So you need to push more into the NGOs, societies, work groups across the ecosystem, across hospitals, government, private sector. They need to come together and have a single voice on what kind of jobs, what kind of incentives they need to have, what kind of training that needs to give to their members. So we need to have some sort of a union, something like that. I think this will be very, very, very powerful. What else? Maybe another thing, this is for companies. So I've seen a lot of great jobs, great EMRs in Turkey, but you are not, even I've seen you're doing some penetration in some West Asia countries, as Uzbekistan, Tajikistan, but still, when we're talking about Middle East, maybe Africa, you're still slow. And I believe you have two issues that you need to tackle. So the first, I believe that in Turkey, you need to open up a little bit for competition from Western world. EMRs like Epic, Cerner, those guys, they have a wealth of knowledge of 30, 40 years of work. They have great, maybe they are, yes, expensive, super expensive, but having at least 2, 3 hospitals deploying these kind of technology and bringing Turkish talents to work on these kind of solutions and being expert in these solutions, this will hit 2 birds in 1 stone. First of all, you will have Turkish experience, which can be sellable to the world. So if you are a Cerner expert, you can easily find job anywhere in any part of the US, Australia, Canada. Same with Epic, same with. So you will have a number of talents who have experience which can easily be sold outside of Turkey. Those people, when they understand the deep science behind Epics, and they can come up with a wealth of knowledge that can allow them to develop better products, Turkish products. So this is one way of doing it. So also, so you will have people who will be sellable. They will add to your digital economy. Those people will have some sort of knowledge out of your box. The second stone, which I think is even very important, those people, when they work outside of Turkey, they will have more of, I can say, communication skills, working with different cultures. So they can help you build your products and sell your products outside of Turkey. Because selling EMR is not like selling drones. So in drones in Turkey, you manage to develop the best product in the world, and it sells by itself. You don't need to do communication or marketing, whatever, because the product is the best product. But with HIEs or HIM or whatever, this is a journey of 10 years or 15 years of relationship. So if you don't have investment on these talents of communication, change management, even different backgrounds, different cultures, it will be very difficult for you to sell your products outside. So even I think maybe this is another advice. I believe that in Turkey, you have a lot of expats, a lot of people coming from different parts of the world, from Asia, from Africa. They get their certificates from Turkish universities. Why don't you use some of those people to be part of your companies? So if you get a Nigerian or a Sudanese or a Malaysian who already studied in Turkey, he knows Turkish, they understand the culture, but he has his own culture as well. So when you have those people to be part of your company, they will help you to sell outside. So I think you need to go a little bit out of the box. And this will help you a lot in all directions for the 2 questions. Thank you very much. Any other question?
Thank you, Dr.
Okay,
thank you. Colleagues, that brings our session to an end. But before we request His Excellency Dr. Shangule to distribute certificates, I would like to emphasize that as WHO, we are working with Health Information Management System Society in the US headquarters, and we were there in Las Vegas 2 weeks ago with the regional director, and we are working with them and having an MOU with them to support digital health transformation in the European region. So again, having them here present in Turkey and talk to countries in the region, I think it's very encouraging sign that we are on the right track, and the best of the best, as Dr. Osama rightly mentioned also, bring the experience of the West to meet with the culture of the East and make sure that we have locally relevant, culturally, linguistically applicable, and culturally acceptable models of digital health application at the facility, at the patient-centered model levels. So I think that's a great way to end this as the way for the future. And thank you, Dr. Osama, again for the great presentation. One point that many of the colleagues wanted to have access to your presentation. So if you can leave your copy with the administration. So Dr. Shangule, sir, if I can request you to kindly come up and then distribute certificates. So colleagues, that brings to an end our very, though it was one speaker, but I think thanks again to Dr. Osama for covering the depth and the breadth of the sort of a digital health transformation and roadmap at a country level, and a great example of Dubai to present to us. But also not just Dubai, but they're talking about at the Gulf Countries Cooperation Council level, so more than one country. So great. Certainly, I'm sure, I think one lesson from this conference here today that really coming from academia, myself, we did recognize the acute absence of academia in the exhibition. So if we are looking at digital health transformation, we will have to start with human workforce capacity development. And there are certificates and courses in Turkey that are being executed and programs that are being run. But having them join such conference next year, I think will only improve awareness and try to bridge that gap between supply and demand and bring the country at par with the best practices in the West and the East. So thank you very much. Have a great day. Thank you.